ask for. The research process looks to answer questions, and it can be done carefully and systematically or haphazardly by trial and error. You need to know the questions to ask to determine which method it was used and how the research was conducted. Different types of research studies include epidemiologic studies. These look at large groups of people, and they can give us clues or insights into what's happening in a group of people that may lead to animal studies or human studies. Animal studies provide preliminary data that may also lead to human studies, but please remember, animal studies don't translate directly into humans. We are not mice. When you are looking at your news feeds, when you are reading about something magical happening, if it says mice, that's very exciting, but you need to wait for for the same thing to happen in people. If mice studies show positive results, they may be followed by what are called cell culture studies, or they may have been preceded by cell culture studies. The experimental treatment is looked at in a petri dish or a test tube. And it may be very exciting. You may find that a drug or a supplement cures cancer in a test tube. But I ask you to keep in mind, when you see this claim that says a common drug or vitamin kills cancer cells in a petri dish, so does a handgun. If it sounds too good to be true, it is too good to be true. If the animal studies and the cell culture studies have good results, then hopefully the studies will progress to human subjects. We have what are called case-controlled studies. These are small-scale epidemiologic studies in which folks who have a certain condition, say prostate cancer, are compared to similar folks who do not have this condition. The researchers can then identify facts other than the disease that differ between the two groups that may give clues about progression, about prevention, and maybe even treatment of a disease. The gold standard are human clinical trials. The other video that I ask you to watch will show you an example of a double-blind placebo-controlled study on potato chips because, of course, we study potato chips. So clinical trials are also known as intervention trials or intervention studies where an intervention is used to determine the effect. In this case, these types of studies will have an experimental group and a control group in which we're looking at groups of people who are given the treatment versus a group of people that are given a placebo. And the absolute gold standard are the double-blind placebo-controlled studies. I want to talk to you about two studies that I was involved in, both double-blind placebo-controlled. The VITAL study, vitamin D and omega-3 fatty acid trial, and something called galectin. It was designed for people with hypertension or high blood pressure. Let me talk about the first one. This was the vitamin D and omega-3 fatty acid study. It was nationwide. It was a double-blind placebo-controlled study. It went on for 5 years and enrolled thousands of people. So if we're looking for the characteristics that show that the results of a study can be considered more dependable, this is a design that you can count on. Oops, yes. So these are called blister packs, and they're 31 days. Anyway, I got them for each month that I was in the study. The long one, this was an omega-3 fatty acid or a placebo. This was vitamin D or placebo. And except for the last month of the study, I was a really good study subject. I took my supplements every day. I took these things with me when I went traveling. But then the last month, But anyway, when the study was over, I found out whether I was taking the placebo or the actual supplement. Let me just first say, so for over that 5-year period, the study was based out of Boston, and even though it was nationwide, living this close to Boston, I would go into Boston every summer. I would be tested, or maybe it was every other year. They took my blood, I did bone density tests, and everybody, regardless of where they lived, filled out questionnaires. every 6 months. There were symptoms. And then at the end of the 5-year period, a month after the study was over, I found out that I was taking the placebo vitamin D, but the real omega-3 fatty acid. The results of the study have shown that supplements have no effect on cholesterol levels with respect to omega-3s, the cholesterol levels, on memory function, on heart disease. And the vitamin D, while we have known for years that it's involved in bone health, did not have any of the other effects that have been associated with vitamin D, including immune function and memory as well. I think something that I talk about a lot in my nutrition class is that we're finding that it's food that can have benefits. Because when you take a vitamin D supplement, that's all you're taking is vitamin D. But when you eat foods that have vitamin D in them, you're getting the protein, you're getting other nutrients in the food that may help the body to use it more efficiently. That's why as a dietitian, unless you have a diagnosed deficiency, I'm not somebody that recommends supplements. So this was the VITAL study. And I did good in that. However, this one, not so much. So this was I don't even know, it wasn't even a phase 1 study. But it was an intervention study, so it was a double-blind placebo-controlled studies. They enrolled about 60 people at the hospital, and I was supposed to take the supplements every day. I did a lot of screening tests. They were checking for something called arteriolar elasticity. The idea was that if this supplement worked, it could reduce risk of coronary heart failure in the future. Apparently, I have a marker in my blood for heart failure. I'm not worried about it because just because it's there doesn't mean anything's going to happen. And when you do your family tree, you'll learn what you have in your family tree. And I don't have any family history of heart failure or heart disease and a lot of cancer. So I said, sure, let me do this. I did a 5-year study, no problem. So I was screened, I was randomized. And she told me that the hardest thing about this study was actually taking the supplements. And I was like, I did it for 5 years. Well, when I opened up this bottle, I don't know if you can see. I don't know how to show these to you. I was supposed to take 18 pills a day. 6 pills 3 times a day. I lasted 1 day. I'm a study failure. And see, that's important to know with studies. If you're going to be trying to get people to take something prophylactically or preventively, you got to make sure that it's something they're going to take, because if you're treating something, there may be more of a motivation to get involved. But to take something for a condition that you may or may not ever get, well, in my case, and I would call myself an N of 1, that means there's only one person that I'm looking at, I would say that my experience was not so good. So I lasted 1 day. But I get to use these as a sample to show you of a study failure, but also a study success. And that's my experience being a participant in a double-blind placebo-controlled study. Jonathan's order for his gauntlet was a little bit different than the one that we just looked at. His started with the in vitro studies, or the petri dishes. We started with animal studies. The important part to remember is that there are a lot of other studies done before we get to humans. When you see something splashing on a headline or on the news, that means that it hasn't gone through all the steps, that it has not yet been through phase 3 clinical trials. It has not been followed up, nor has it made it to publication. Things need to go through the gauntlet. Article in Cocktail Chatter that I ask you to have a look at if you're interested and you want to know what I'm talking about here. The article is called Risks Seen in Cholesterol Drug Use in Healthy People. There was a medication that was shown to reduce blood cholesterol in people. It also increased risk of type 2 diabetes. What was interesting was this one doctor who was interviewed and said, we found a 55% reduction in heart attacks, a 48% reduction in stroke, 45% reduction in angioplasty bypass surgery, which we'll talk about when we get to heart disease. He continues to say, I felt I had one shot at a controversial hypothesis and it worked really well. Look at these huge numbers, 55, 45, 48. Sounds enormous. Relative risk or absolute risk? Of course, it was relative risk. Relative risk always is the larger number. But let's look at the absolute risk. Let's look at those actual numbers. The rate of heart attacks, for example, was 0.37%, or 68 patients out of 8,901. This was what occurred in the control group, the group that took the sugar pill. Among the experimental group, the folks that took Crestor, it was 0.17, or 31 patients. The difference between the control group and the experimental group was 68 to 31, and that is truly a 55% reduction in relative risk. In absolute terms, it was 37 out of 8,901 people, or 2 out of 1,000 people who experienced a heart attack. Again, do you want to take a medication for the rest of your life based on those numbers? This is something you have to decide. If you have a strong family history of heart disease, then maybe it's something that you want to do. What I'm not addressing here is the diabetes risk. These are things you need to know when you're making decisions about taking a medication for the rest of your life. Again, assuming that you have insurance and support. So it's the absolute number that you need to know to make your decision, not the relative number. So yes, 55% is truly statistically significant. But the question is it clinically relevant? Of course, a meme, because why not? I'll give you a second to look at it. When you see the entire body of peer-reviewed scientific evidence going along the highway, please don't take a turn off to a single fringe study or Netflix. I call them shockumentaries. They're very exciting. They have great optics because, let's face it, peer-reviewed scientific literature needs a PR team. And of course, there's no cure for our addiction to medical hype. That's why I'm offering this class. That may be why you're taking it. Let's have a look at Dr. Charjani and his amazing cure for cancer. also have a bias for the McGill Office for Science and Society. Can you tell? A few more things before we finish this topic. A simple guide for determining whether or not you should fact check a source or claim. Well, I'll let you have a look at it. I think you know. You should be able to tell. So remember, correlation doesn't prove causation. Remember the importance of absolute versus relative risk. If it sounds too good to be true, it probably is too good to be true. Remember the phrase statistically significant, but not clinically relevant. And of course, it's the dose that makes the poison. We'll get to that, I promise. Now, this video that we're going to watch, that I want you to watch for the second day of class, is something that I made for my nutrition class, but it talks about the scientific method. It's about potato chips, what's not to like. And I want to ask you to think about where you think the phrase correlation doesn't prove causation fits into this video. What is the correlation? What is thought to be the causation upon which this study was based? All right, folks, see you later.